Hi everyone, my name is Kayla Brennan, and my research proposal is on what barriers do certified nursing assistants, CNAs, face in reporting suspected older abuse in a hospital and long-term care settings. This topic is important for social work and healthcare fields because reporting abuse is hard, but also you want to make sure that you're reporting the correct person and it's not someone that's doing it to themselves or they're trying to get someone else in trouble. So reporting abuse in a hospital and also home care health settings is hard for nursing assistants. So the type of research that would be done for this proposal would be qualitative research, and that is doing interviews and focus groups on CNAs to tell us about their experience and what they've been through. So that can be from nursing assistants that have been doing this job for 10 years, 5 years, and a little bit less than that, because everyone does have their own experience, and their own experience could be different in hospitals, in home health care settings, or nursing homes. Sorry. So elder abuse is a critical issue in hospital and long-term care settings where older adults may experience physical, emotional, and financial neglect, mistreatment. CNAs who provide patient care often are the first to witness the signs of abuse. However, researchers suggest that underreporting is a widespread issue and raising concerns about systematic barriers that prevent CNAs from reporting suspected abuse. Understanding these barriers can inform policies and interventions that could enhance elder protection and improve CNA support systems. So, the roles of CNAs in patient care and abuse dedication. So the big problem will be the study will examine the challenges of CNAs face when attempting to report suspected elder abuse. Researchers also indicate that CNAs often encounter fear of retaliation, lack of training, institutional pressure, and confusion regarding reporting these protocols. Understanding these challenges will provide insights into improving reporting mechanisms and ensuring the protection of vulnerable older adults. The timeline of this issue extends over decades with growing concerns as the aging population increase. So, my hypothesis is CNAs face multiple systematic, organizational, and personal barriers that contribute to underreporting of elder abuse. So the research the research will focus on the prevalence and impact of elder abuse in healthcare settings, CNA's roles in abuse detection and challenges they face, institutional and policy related barriers to reporting, and gaps in research, particularly regarding CNA's lived experiences. The review will examine micro individual CNA concerns. The meso will be the workplace culture, and the macro will be the state and federal policies, factors including abuse reporting. To identify these theories, I would say the ecological system theory and the theory of planet behavior would go well with my research proposal. So the ecological system theory is important for this research proposal because they will analyze how individual, institutional, and policy related factors impact CNA's ability to report elder abuse. And the theory of planned behavior will help explain how CNAs perceive control attitudes and subject norms influence their detection to report abuse. So the data that will be collected from this research proposal will be analyzed using thematic analysis to identify patterns and common themes in CNA's experience. I will use Atlas, ATLAS, to analyze qualitative data collected from CNA interviews and focus groups for this study. Atlas allows for coding, thematic analysis, and categorization of responses to identify key barriers CNAs face in reporting suspected elder abuse. This software facilitates efficient textual data organizations, visualization of themes, relationships, and comprehensive analysis of emerging patterns. If a quantitative component is added, descriptive statistics will analyze survey responses regarding CNA experience with reporting. So the research design will be a qualitative study using in-depth interviews and focus groups. The participants, I will probably have about between 15 to 20 CNAs working in hospitals or long-term care facilities. And then the data collection will be semi-structured interviews and focus groups to gather perspective on barriers to reporting abuse. And the rationale for method choice would be qualitative methods allow for an in-depth exploration of CNA experiences and perceptions which are difficult to quantify through surveys alone. This research is crucial for improving CNA training, workplace policies, and elder protection law. Findings will help inform policy changes that make reporting safer for CNAs, improve training programs that enhance CNAs' knowledge of confidence in improve trainings that enhance CNAs in reporting abuse and feel confident in reporting adult abuse. Encourage healthcare organizations to create supportive environments that prioritize elder safely. And then the impact of culture diversity and oppression with CNAs with reporting adult abuse. So the cultural factors will be social class, race, ethnicity, gender influence, and elder abuse experience and CNA reporting behaviors. The challenges included would be language barriers for non-English speaking CNAs or residents, power imbalances between CNAs and higher level staff affecting confidence in reporting, and systematic discrimination that may lead to fears of retaliation, particularly among CNAs from marginalized groups. Some ethics to consider would be ensuring CNA participation is voluntary and confidential to prevent workplace retaliation, adhering to the NSW Code of Ethics, which emphasizes social justice and the responsibility to protect vulnerable populations, and securing an IRB approval to ensure ethical practices. Some of my recommendations based on the findings from this research would be mandatory training programs for CNAs on elder abuse detection and reporting protocols, workplace policies that protect CNAs from retaliation, and advocacy for legislative changes that provide better protections for CNAs reporting abuse. Thank you for listening to me about my research proposal on CNAs on reporting adult abuse. It is very important, and especially since more older adults right now are starting to retire and they are going to need that help to someone to take care of them. So I think it's important for CNAs and also people who are taking care of their loved ones at a certain point is knowing what's okay to do taking care of an older adult and what's okay not to do. And I hope this presentation has shown you that there is some work that needs to be done in the healthcare settings and to improve and better accommodate reporting adult abuse for older adults in hospitals and healthcare settings. So my name is Kayla Brennan, and I hope you enjoyed this presentation.